Tarpon Springs, Florida is located in Pinellas County along the Anclote River. This city is south of the Palm Harbor Clearwater area and north of the Newport Richey area. Tarpon Springs is over 150 years old. It was settled early in 1864 by William L. Thompson, who planted crops to help grow the land near the Anclote River, this river that runs through most of Tarpon Springs. Later on, the Ormonds arrived and settled near Spring Bayou, which is one of the main bayous in Tarpon Springs today. This bayou is also famous for the Greek tradition of Epiphany. The waters are blessed by the priest and a cross is thrown in for divers to retrieve. This is one example of Greek culture that surrounds Tarpon Springs. When further development of the city was needed, a wealthy saw manufacturer from Philadelphia bought over 4 million acres of land, giving way for Tarpon Springs. Mr. Hamilton Disson hired engineers to develop the land with streets and buildings. Tarpon Springs had business booming in early 1900s when the sponge business and Orange Belt Railroad brought commerce to the Tarpon and Pinellas Peninsula. John Chaney was the originator of the sponge business in the Tarpon Springs area. However, it was John Kokoris, a Greek immigrant from New York, who expanded the business, and the Tarpon Springs sponge docks started to grow. The Greek immigrants settled and made Tarpon Springs their home and filled it with businesses for tourists to experience Greek culture and traditions. This is the sponge docks in the Tarpon Springs area people know of today. This tourist industry is alive and very popular in the United States. Tarpon Springs has opportunities for low-income housing. Currently, there is a total of 206 units available for low-income housing available to those who qualify. There are neighborhoods and residences, including apartments, townhomes, and gated communities for those who do not need assistance. However, housing can be expensive due to the waterfront properties. The roads in Tarpon Springs are very old and dated. Many roads in Tarpon Springs are historical brick roads that have not been replaced to keep the heritage and the history of the city alive. Other remodeling efforts are only done on parts of the community with little historical significance. Tourism is very significant for financial stability of the city. The Tarpon Springs sponge docks are sought out from people all over the country. The tourism keeps Tarpon Springs financially set, along with the Howard Park beaches. According to the 2010 U.S. Census, the population is 20,678 people total. This is made up of a majority of Caucasian Americans at 93.9%, African Americans at 1.4%, American Indians at 0.3%, Asian Americans at 2.3%, and Latinos 7.3%. Other races make about 2%. The unemployment percentage is 5.8% with an employment rate of 44.7%. The distribution of wealth among the city is pretty even, with the majority belonging to the upper class. Florida Hospital North Pinellas, previously known as Helen Ellis, is the main hospital in the Tarpon Springs area. It serves every patient population and it is open 24 hours a day, 7 days a week. There are multiple family care physicians and private practices in the area that offer walk-in care to patients with the appropriate insurance. Those who do not have insurance or cannot afford healthcare costs may go to the health department for free screening, vaccinations, and other healthcare needs. The top communicable diseases in the area are pneumonia, HIV/AIDS, and viral hepatitis. Tarpon Springs offers various environmental services and activities to the residents. 6 parks are located throughout Tarpon Springs, providing a variety of recreational opportunities. Sunset Beach, Howard Park are beautiful areas for picnics and family activities in addition to fishing and boating. The Pinellas Trail goes through Tarpon Springs for biking, jogging, and walking. The safety needs of Tarpon Springs appear adequately served by their own police and fire rescue services. The police department has 48 sworn officers and has a response time less than 5 minutes. The city has 3 fire rescue stations staffed by 33 firemen and EMS crews that respond to fires, motor vehicle accidents, natural or man-made disasters, providing emergency medical assistance. Tarpon Springs Public Works provides water, sewer, and trash pickup to city residents. The city operates its own sewage treatment plants and recycling program. The streets and landscape of Tarpon Springs is well maintained throughout our windshield survey. Trash receptacles are adequate and well covered, the street is evenly paved, no visible trash on the roadside, and the streetlights are well lit during the night. Two areas of environmental concerns to the community include narrow roadways and limited bike lanes. With increasing population in the city, the narrow roadways present safety issues for pedestrians and increased traffic congestion. The city also lacks bike lanes, which can endanger cyclists who can compete with cars in limited road space. The Mayor and Board of Commission consist of 4 commissioners and as policymakers and legislative authority. The residents of Tarpon Springs can attend the commission meetings in person or view the meeting on YouTube or live stream. The commission meeting is well attained. The city also offers various online services for its residents, including utility, public records, permits, and others. The city's website provides important information regarding city departments, officials, and policies. After reviewing the 2017 budget, it appears there are no major area of concerns regarding the economic and public policy of the city. The largest expenditures in the budget is designated to the physical environment to improve public health and safety and prevent any environmental pollution. All department expenditures are reviewed extensively for potential cost saving and areas to improve. The city also takes an active role in promoting tourism, encouraging private groups to increase their participation in funding tourism promotion and advertising. 6 community problems are identified according to its priority and severity to the community. 29.4% of population live below poverty level compared to 26.6% for Pinellas County and 25.5% in the state of Florida. The city also suffers from high unemployment rate of 5.8%, which is slightly higher than the 5.7% state rate. These 2 problems can affect the residents' health related to living conditions, healthcare accessibility and affordability. Limited healthcare facilities, especially emergent and psychiatric care, possesses major threat to its predominantly elderly population, which has a higher risk of chronic disease and developing diseases. Heart-related diseases has the highest mortality rate in Tarpon Springs community. The incidence of cardiac disease is greatly increased in the elderly, which is the largest population in the community. Other modifiable factors such as sedentary lifestyle, tobacco use, and obesity also affects the health of this community. With increasing population in the city, the narrow roadways present safety issues for pedestrians, which can increase traffic congestion and accidents. The last problem is that Tarpon Springs lacks public assistance programs such as food banks, housing vouchers, homeless shelters for its increasing low family income and homeless people. A large portion of the population in Tarpon Springs lives in below poverty level. There is a strong link between poor health and socioeconomic status resulting from poor housing, malnutrition, inadequate sanitation, unhealthy diet, and being uninsured. In the global perspective, millions of poor people still do not have access to clean water, and many of areas lack basic sanitation. In some Africa countries, the government is helping poor rural communities to install clean water access, pave local roadways, and place private toilets in the community, which yields good results in decreasing the spread of communicable diseases. This is a global initiative to provide free vaccination to the vulnerable poor children through various programs such as free vaccine clinics, increased immunization coverage, and partnership with local pharmaceutical companies. As a community health nurse, the city should allocate more funding to improve population health through disease prevention and health promotion strategies. The nurses have opportunities to work with local agencies to provide education on disease prevention, promote healthy lifestyle,